Good afternoon, and welcome to the Johns Hopkins 30-minute COVID-19 briefing, where we provide live insights from the experts who lead our work at the Johns Hopkins Coronavirus Resource Center. For the next half hour, we'll focus on what you need to know right now about the COVID-19 pandemic and public health responses. This is our first briefing for 2022, and we will continue to offer these 30-minute briefings regularly on Fridays this year. I'm Dr. Lainie Rutkow, a professor at the Johns Hopkins Bloomberg School of Public Health, and I'm part of the leadership team for the Johns Hopkins Coronavirus Resource Center. We'll be providing answers in real time, so please submit your questions in the box at the bottom of your screen. Today, I'm joined by two guests. First, Beth Blauer, who is Associate Vice Provost for Public Sector Innovation at Johns Hopkins and the data lead for the Coronavirus Resource Center. Beth is going to talk about trends we're seeing in the COVID-19 data. Dr. Bill Moss is Executive Director of the Johns Hopkins International Vaccine Access Center and a professor at the Johns Hopkins Bloomberg School of Public Health. Bill is going to give an update about COVID-19 vaccines. I'm now going to turn to each of our speakers for a brief overview. Beth, first to you. Given the transmissibility of the Omicron variant and the increased use of at-home rapid tests, what is the state of COVID-19 case data or even COVID data more generally?
Yeah, thanks. Thanks, Lainie. It's been a bit of a wild couple of weeks as we have emerged out of the Christmas break, through the holiday break, and back to school and back to work. And I just want to kind of reset and overview a little bit about COVID data and what we look at when we're looking at COVID data to understand the impact that it's having on local communities. There are a set of data that we look to. We look to case data, we look to testing data, we look to death data, we look to hospitalization data, and we look at them in the aggregate. We want to get a sense of what the impact of COVID is on our communities. And so in order for us to understand how COVID is growing and the impact that it's having on those communities, we have to look at that full set. And at different times over the arc of the pandemic, that data has improved, has some states have clawed back on data we've talked about on this update before. We've seen additional data reporting, but we also see a lot of noisiness, particularly in this sort of post-vacation, post-break period of time. So we saw some incredibly high numbers for daily counts of cases, and it begged a larger question about how reliable the case data is. And what we want to make sure that everyone understands is that we're not just looking at a daily count of that data, but we're looking at trends in that data. We're looking at averages over a week period of time, over 2 weeks period of time to really get a sense of the growth. So I'm going to go through these data, but I just want to also make sure that we are sort of collectively understanding that it's a composite, that we have to look at the case data, the death data, the hospitalization data, the testing data, and also vaccination data to get a really full understanding. And not one of those is more important than the other, but it is really a composite of how we look at that data. So we all know we've seen an incredible surge in the case data. We've had a total of 4.2 million cases reported in the last week. That's up 72% from the prior week. That's almost twice what we saw this time last year. And so the case data is really emblematic of that surge that we've been seeing manifesting across our communities. The surge is largely in the Northeast, where we're seeing the greatest number of states that have case increases. But what we're seeing is starting to see a spread of that surge, where we're seeing a rapid increase in the percent of states that are experiencing a sustained increase in cases in the Southeast and also in the West. So while we've seen a concentration of case growth in the Northeast, that's starting now to spread across the country. The good news, the silver lining that we're seeing is that we're seeing, even compared to where we were last last year, with the volume of cases much lower, we're still seeing deaths holding steady and not increasing at the same rate that we're seeing case data. And that's telling us that it's giving us a sense of what Omicron means in the community, but also it's giving us a sense of the efficacy of vaccination and the mitigation efforts like masking and social distancing that are actually helping us hold that death data down. So as of today, we are at 834,000 deaths in the United States as our cumulative number, but we are seeing that, again, that number stay steady. We're only up about 3.5% week over week, but we saw that last week's data was a little bit down from the prior week. So we are seeing a little bit of fluctuation. Death data, as just to refresh everyone's recollection, lags behind case data. So it's important also to keep that in mind. As far as testing goes, we're seeing test positivity like we've never seen before. We're seeing incredibly high numbers of positivity, which means a couple things. Our testing infrastructure is constrained. We know that it's difficult to get access to testing. And so those people that are really seeking out that testing are typically symptomatic, and they're also going to be, and because we know the rate of transmission of the disease is so high, it's likely that they're going to drive that positivity. Right now, we know that that 5% level that we look for, that the WHO recommended, no states right now are below that 5%. And we're seeing some of the highest rates of positivity in places like Kansas, New Jersey, Pennsylvania, Nevada, and Colorado. Hospitalizations are also steadily increasing. We're not seeing the same rate of increase in places in the Northeast where we've got a lot of vaccination coverage, which also really encourages the information that we know about how effective vaccine and boosting is to get at our capacity in hospitals. But hospitals are still incredibly stretched because of the volume of cases. It is necessarily creating an opportunity for us to still max out on that capacity. And so it's an indicator that we really are going to be continuing to measure. We're seeing a continuation of Omicron, not just here in the United States, but also globally, with the biggest impact right now in the data in Europe, with Ireland, Cyprus, Denmark, France, really driving some of that growth. But again, the United States is the big story here. We are really driving the Omicron spread, and it's really manifesting in this incredible data around our test positivity and our cases. So I'm going to hand it back over to Lainie and be prepared to answer any questions that might be coming in.
Thanks so much, Beth. And before I turn to Bill, I want to remind our audience, please do submit questions in the box that you see at the bottom of your screen for our experts. I'm keeping an eye, and I do see your questions coming in now. Bill, over the last several weeks, we have seen the proliferation of booster mandates, while a significant percentage of the United States and also the world remains unvaccinated. What do you see as the key vaccine challenges for 2022?
Yes, thank you, Lainie, and it's good to be back here. I see a number of opportunities in 2022, but also a continuation of many of the challenges that we've faced thus far. I think the big wild card in the coming year will be whether or not we see the emergence of new variants, particularly those that can escape immunity and that are highly transmissible, the way Omicron has both of those characteristics. I think what we're going to see in this coming year, Lainie, we're going to continue to see an expansion of vaccine eligibility to young children. We did hear in the past several weeks about the trial of Pfizer's vaccine in children 6 months to those younger than 5 years of age. And what we learned is that the 2 doses of the lower dose vaccine, the 3 microgram vaccine, did not elicit the same level of neutralizing antibodies in that 2 to 5 year old age group as it did in an older age group, 16 to 25 years of age. It looked like the antibody response was good in those younger than 2 years of age with that lower dose. So what Pfizer has elected to do is think of this as a 3-dose schedule and added a 3rd dose to their trial. a third dose of that smaller 3 microgram dose 2 months after the second dose. And so now what we're expecting, this is going to result in some delays in an emergency use authorization for the Pfizer-BioNTech vaccine for children younger than 5 years of age, probably to the second quarter of 2022. So one of the things I expect to see is this broader eligibility into younger age groups with our COVID-19 vaccines. We've also seen recently, Lainie, an expansion of booster dose eligibility. First the FDA and then the ACIP and CDC authorized use of the Pfizer-BioNTech COVID-19 vaccine for boosters for children 12 to 15 years of age. They also shortened the time period after that second dose from 6 months to 5 months for that booster dose. So we're seeing a broadening of the booster dose eligibility. The CDC and FDA also authorized booster doses for younger children 5 to 11 years of age, who are at high risk, those who are immunocompromised. And so another thing I expect to see in 2022 is further expansion of the booster dose eligibility, perhaps to all children 5 to 11 years of age. Obviously, we'll need to see both the safety and the immunogenicity data on that, and both the FDA and CDC will need to weigh in. The big challenges here, even as we're seeing expansion in eligibility, is the low coverage. And I continue to be surprised particularly by the low COVID-19 vaccine coverage in children 5 to 11 years of age. Despite many months of eligibility, only 25% of children in the United States, according to the CDC, in that age group have received at least one dose, and only 16% are fully vaccinated. So even with these expanded eligibility of, say, booster doses into younger children, we may not see the coverage. And so that's a continued challenge going forward. Another thing I expect to see in 2022 are new vaccines and vaccine platforms. According to the New York Times, there have been 9 approved vaccines, 19 authorized vaccines, and 34 vaccines in phase 3 trials. So there are many more vaccines in the pipeline. I think some of the more exciting ones coming along are the protein-based vaccines. So obviously very different than the mRNA or the adenovirus vectored vaccines. And in some ways, a more traditional type of vaccine platform, administering key proteins or injecting key proteins to induce that protective immune response. The Novavax vaccine has shown very high protective efficacy in trials, 90% or more. They have had problems with kind of getting the manufacturing of that vaccine sorted out, but we did see in the past several weeks the World Health Organization approve emergency use listing. So this vaccine can now be delivered through COVAX to low and lower middle income countries. The European Union authorized this vaccine. So this vaccine will be a key vaccine globally. And we expect that Novavax will submit the final documents to the FDA perhaps by the end of this month for authorization in the United States. So we will see this new protein-based vaccine. Another protein-based vaccine that's been getting a lot of attention recently is the one developed by Baylor College of Medicine in collaboration with Texas Children's Hospital. Uses very standard protein vaccine technology. It's called Corbavax. And this vaccine will be manufactured in Europe as well as at the Serum Institute of India. And it's already received emergency use authorization in India just this past December. So a number of different vaccines in the pipeline, and I expect we'll see quite soon a more widespread use of these protein-based vaccines, perhaps as booster doses in a mix and mass type strategy. The other thing I'm on the lookout for, Lainie, are Omicron-specific vaccines. We know that all 3 vaccine manufacturers for authorized vaccines in the United States, Pfizer, Moderna, and Johnson & Johnson, are working on Omicron-specific vaccines. It's really going to what will determine this is really the epidemiology, whether Omicron kind of continues to be the epidemic and endemic variant in the United States, then I think we will see Omicron-specific vaccines. If it really kind of dies out and is replaced by another variant, for example, there'll obviously be less of a need for that. We might even see multivalent vaccines against different variants. And there's a lot of hope. This is still a ways away, but what we call a pan-coronavirus vaccine that would really target some of the conserved proteins in the SARS-CoV-2 that may be highly effective against against multiple variants. And other challenges going forward, we're going to continue to face challenges with misinformation, disinformation, controversy of vaccine mandates. As we're talking now, the Supreme Court is hearing oral arguments to challenge President Biden's attempts to impose vaccine mandates on large employers, those with more than 100 employees, as well as healthcare workers who participate in Medicare and Medicaid programs. So we're going to continue to see this debate that may sometimes get acrimonious around vaccine mandates. And then lastly, Lainie, the big challenge are global vaccine inequities. I think there are reasons for optimism in 2022. I think we're going to see the supply problem better addressed in 2022 than we've seen in the past year or so. What we're going to see, as I said, we're going to see new vaccines become available. We're going to see vaccine manufacturing scaled up, but that's not the only problem. As we've talked before in this setting, there are still going to be challenges in many low-income countries in delivering these vaccines. We're going to face problems with demand, and we're going to need good data to tell who's being vaccinated and who's not. We're still in a situation where about 3/4 of the vaccines that have been delivered in the world, across the world, have been administered in high and upper middle income countries, and only about 1% to low income countries, with Africa only about 14% of the population having received at least one dose. So I'm optimistic going forward, but we're still going to see and face many of the challenges that we've seen over the past year with regard to COVID-19 vaccines.
Much, Phil. Before I turn to the questions that are coming in, I want to remind those that are watching that we do offer a weekly subscription newsletter. You'll see a banner that you can click on to subscribe. It's called The Week in COVID-19, and it is a great way to get the latest news on the virus itself, variants, and other critical trends as analyzed by our experts, delivered to your inbox on Mondays. And now I'm going to switch to the questions. So, gosh, Bill, I'm gonna ask you something that represents a whole lot of questions that are coming in, which is, do you anticipate that we will need to get boosters every 6 months or so in perpetuity?
Yeah. The short answer is we don't know yet, but I don't think that's really going to be a feasible public health strategy going forward. And so, it's really going to depend upon what tricks this virus has up its sleeve and whether we are going to see more variants that, again, as I said earlier, are highly transmissible and very importantly escape, immunity. I do recognize, and perhaps I've said before here, that there are evolutionary constraints on the virus. The receptor binding domain of the spike protein needs to be able to bind to our host cell receptors, and that does constrain somewhat, the ability of this virus to mutate against our immune responses. Just to speculate completely, my guess is that we will not need boosters every 6 months in perpetuity. That this will settle down. That we will have a dominant kind of endemic variant, and whether our current vaccines will continue to be used and will be protective against that, or whether we'll need to adapt our vaccine, I think that'll be our strategy. But it's really going to depend on how rapidly this virus can mutate and escape immunity.
Thanks, Bill. Beth, question for you. Are we able to tell from the case data what can be attributed to Omicron and what can be attributed to Delta?
Right now, the disaggregation of the case data by variants is very difficult. That's directly related to how quickly we can understand and do the analysis that's required on the back end of collecting those samples, and doing the analysis on what is being collected. The other, I think, complicating factor about tracking the variants is a lot of the positivity that we're also seeing is being driven by tests that don't necessarily collect the samples in a way that we would need to be able to dissect which variant is producing the viral response. We do know that Omicron has taken over as the dominant variant. We can get that from extrapolated data, but looking at the case data right now, it is really difficult to tell with a lot of granularity what is Delta versus what is Omicron.
Thanks, Beth. Bill, I don't think you mentioned this one in your 2022 predictions, but do you think we're likely to see some kind of a combo single vaccine for flu and COVID?
I think there's certainly something attractive about that. It will depend, again, what our COVID-19 vaccine needs are. But just should it turn out that when SARS-CoV-2 eventually becomes an endemic virus and is a seasonal virus in which the seasons overlap with influenza, and I think there's a high probability that that'll happen. That'll be a winter respiratory virus, like many other respiratory viruses. I could see a combined flu SARS-CoV-2 vaccine that could be administered, where it's administered together, the same target populations at the same time of the year. But it's really good. I think it's a little early for that, because we'll have to see how SARS-CoV-2 kind of plays out in terms of new variants and seasonality going forward.
Thanks, Bill. Beth, we know that there's a whole lot of use of rapid tests right now, and that the positives that come back on those often are not being confirmed by PCR, which means they're likely not being reported into any system. Do we have any way to estimate what we're losing, what we're not able to capture in the case data due to at-home rapid tests?
Yeah, so the at-home rapid tests are definitely creating a complication in collection of case data. You will see some states reporting antigen tests. Those are more likely rapid tests that are happening in clinical environments, whether those are long-term care facilities or public school systems that are using those tests to try to very quickly get a handle on a specific population. We also have some of the test providers that are taking, if people self-report whether or not they are positive or negative on those home tests, using those app-based reporting mechanisms, we're seeing some of that data slowly filter into case data, but it is a very slow, and it's also very dependent on people who are using those at-home tests doing that last step of reporting what the outcome of that test was into the app, so that information can transfer. So we know that our positivity rate, and that we also know that our case rate is influenced by this. We know many people are relying on those home tests to figure out whether or not they're positive. The benefit of the home test is still outweighing the fact that we are losing out on really getting the insights, because we want to make sure that people know if they're positive, that they're isolating immediately, that they're, again, engaging in those mitigation strategies. So while it dilutes the ability of the case data to generally reflect where we are, it's still a very important tool in the way that we think about collecting COVID information.
Thanks, Beth. Bill, question that is close to your heart. What is the U.S. doing or planning to do to help get the rest of the world vaccinated?
Yes, this is a really important point, and the Biden administration has made moves in terms of donating vaccine doses and attempts to try to scale up and support vaccine manufacturing in other countries. For example, in India with Biologics E. So there are attempts by the government, but I still think I still think that there's more can be done to really address these global vaccine inequities. And the fact that, experts have been saying for a long time that we're going to see new variants as long as this virus is circulating, not only in the United States, but globally. And that just provides the virus with more opportunities. And until we can get a much higher proportion of the world's population vaccinated, we're going to continue to see the emergence of these. So there's real self-interest here in terms of increasing global vaccine access. But it's going to be donating doses through the COVAX mechanism is a great way to do that. There are also bilateral donations to countries, but really also scaling up vaccine manufacturing. And I will say that I talked about those two, particularly the protein-based vaccine developed by Baylor and Texas Children's. That's a relatively easy vaccine to be manufactured. As I said, it uses kind of standard vaccine manufacturing technologies, and they promote that as the world's COVID-19 vaccine because of the potential to scale up the manufacturing. So I think the US government should do all it can to help support those activities to increase access to vaccines, particularly those that can be more readily manufactured in other countries.
Thanks, Phil. And you'll have the last word today since we're just about at time. I'd like to thank Beth Blauer and Bill Moss for joining me and give a big thank you to everyone who joined us, and especially to those who submitted questions for our experts to answer. This briefing will be archived and available on coronavirus.jhu.edu. As a reminder, this is our first briefing for 2022, and we'll continue to offer these 30-minute briefings regularly on Fridays this year. On Friday, January 21st at noon, we will have our next Pandemic Data Initiative Expert Forum, and that will focus on uses of healthcare data throughout the pandemic. I'll look forward to seeing you later this month, and until then, thanks and stay safe.